Oxygen therapies as yeast infection remedies are extremely effective natural antifungal treatments, the treatment of choice in chronic, intractable cases of systemic fungal infections and, in my opinion, superior to all prescription antifungal drugs. If Candida albicans loves a lack of oxygen, it makes sense that providing your body with more oxygen will help in your fight against yeast infection. The safety of oxygen therapies as a natural remedy for yeast infection is ensured when they are part of a comprehensive health-promoting program that takes into account optimal diet and antioxidant nutritional supplements such as beta-carotene, vitamin C, vitamin E, and selenium. In the past decade, oxygen therapies like ozone, hydrogen peroxide, coenzyme Q10, liquid stabilized oxygen, and other oral supplements have gained prominence and credibility. The escalating demand for oxygen therapies is linked to increased incidences of allergies, chronic fatigue syndrome, AIDS, candida, and cancer. Oxygen therapies are extremely controversial. Many physicians and clinics offering them in the United States and Canada have been forced out of practice by government agencies. For the most part, ozone and hydrogen peroxide therapies are only available in Mexico, some Caribbean countries like the Bahamas, Cuba, and the Dominican Republic, as well as in Europe, especially Germany and Eastern Europe. The reasons are political, not medical or scientific. If you want ozone or hydrogen peroxide therapies in the United States or Canada, don't call your medical doctor, who cannot legally use ozone therapy. Instead, call a naturopathic physician and ask him or her to name the rare few who use ozone therapy as yeast infection remedies, then call your travel agent. Hydrogen peroxide and ozone are naturally occurring gases capable of providing more oxygen to cells, tissues, and organs. For nearly a century, both therapies have been used around the world by conventional and alternative medical doctors, in oral, rectal, vaginal, intramuscular, and intravenous forms as yeast infection remedies. As with all therapies, toxicity may be encountered. If ozone is inhaled in large quantities, it can be toxic. Overdoses of either hydrogen peroxide or ozone can cause inflammation, nausea, indigestion, diarrhea, coughing, chest pain, asthma, dizziness, and headaches. Combined with environmental pollutants like petrochemical hydrocarbons, ozone can irreversibly damage lung and other body tissue. The same is true of hydrogen peroxide, oxygen, water, and other nutrient. To categorically say ozone is toxic or hydrogen peroxide is toxic is almost as ridiculous as saying water is toxic. Toxicity is a matter of degree. It is a biochemical fact that the body manufactures its own hydrogen peroxide under certain conditions. For ozone, hydrogen peroxide, oxygen, and water to become toxic, huge amounts far more than the recommended kmi used in therapy would have to be consumed during yeast infection remedies.